Hey guys, so in today's video, I thought that I would talk about the different sensor sites that I have used as someone who has a Dexcom G7, or someone who uses the Dexcom G7, I should say, because it sounds a little weird when I say someone who has a Dexcom G7 because you change the sensor out every 10 days. So currently, my current site is up here on my chest. This is the first time that I have tried the chest. Other than that, I have used the forearms. I avoid the back of my arms because I'm currently losing weight after having weight loss surgery, and so I have a lot of extra skin slash fat there, and I don't feel confident that my sensor would stay on the back of my arm just because of that. So I tend to use my forearms. I've used my thigh. And like I said, this is the first time that I have actually used my chest. So I think I have 2 days left on my current sensor, but I thought that I would talk a little bit about my favorite site so far. And I would say that it's currently a toss-up between my thigh and my chest. So there's a reason why. So for those of you who don't know, I currently work as a medical assistant in an urgent care clinic located within a critical access hospital. And so when I use the forearms, they're obviously very visible to my patients. And the one thing that I do worry about, I could care less if my patients see the fact that I'm wearing a Dexcom. I've had multiple patients just ask me what it is. A couple people thought it was like a heart monitor of some sort or a Holter monitor, because they've heard that there are smaller versions that you can wear that look like that small, I guess. I don't know. I don't really know exactly what they were talking about because I don't have very much experience with heart monitors. But obviously, as someone who wears a G7 sensor for 10 days at a time, my sites are constantly changing. The one site that I had thought about trying but haven't yet is on my stomach. I know a lot of people feel like that area is the easiest for them. One thing I don't like about the forearms is sometimes I get a little bit sick and tired of having something there, because I usually put it like right around here, but sometimes it gets knocked into things easily, or like when I'm trying to take a patient's vitals, I feel like my stethoscope sometimes hits it when I'm moving to take my stethoscope off. I've had the bell of the stethoscope hit it, and it feels uncomfortable, especially if I'm not wearing the grip shield that I currently have. Like on this one, I don't know if you can tell, but the little shiny part is a grip shield. And I just did that just to make sure that it was safe and secure where it is right now. So basically, the reason why I felt like I needed a break is because one, I had been wearing the G7 sensors on my forearms for quite a long time. So for a few months at least, I was back and forth from arm to arm every 10 days. And I felt like my arms just kind of needed a little bit of a break. So at this point, they've had at least 2 sensors. So we're talking about 20 days almost at the very least that my sensors have not been on the forearm. I will probably do my next sensor on my forearm just because it's been a while. But it's been nice to not have it visible to patients, not have to explain what it is, not have all of the questions, and just kind of having it out of the way, and not having to worry about hitting it up against something while I'm working, or how my overpatch looks, because I will not lie, this overpatch is currently falling off around the edges, it's coming loose all the way around. So that's the only thing that I'm currently worried about. And these are my favorite overpatches. So I don't know if it's just the placement and the fact that it is so my bra is kind of on the edge of it. I don't know how well you can see that, but my bra kind of sits over the one edge of it. And I've noticed that this is the one spot where those overpatches have come up all the way around, before the end of the 10 days. So that is one concern that I have. But I do feel like it is a pretty inconspicuous area, and it is also the area that I feel like I have to worry the least about as far as hitting it up against something. The only thing that I feel like I've had to be really careful about with having the sensor on my chest is like making sure that my bra is not super tight, because I do have a couple of sports bras that are like for workout purposes, and they do tend to hit the edge of that sensor. So I have pulled them over a little bit just so that they're not like laying on top of it so firmly that it could potentially cause a compression low or anything like that. So that's the reason why I say, like, with the thigh and the chest, those are the two that I am kind of in between as far as those being my favorite sites. I do not mind the forearm either, just because, like I said, I don't really mind answering the questions, and it's not painful for it to be on my arm. I have hit it up against things in the process of working and just my everyday normal life activities, but you know, I have yet to rip a sensor out because of that. So there's that. I guess that's a good thing, but I don't know. I do kind of like it being here though, because I feel like it's the most out of the way. Like, I don't put the sensor on my right thigh just because I tend to sleep on my right side. And so I'm a little bit wary of compression lows and things like that. I may try it at some point, but like I said, I do tend to sleep on my right side quite often. So I would be concerned about getting compression lows from laying on it or something like that. I do tend to use the top of my thigh. So unless I'm sleeping like on my stomach or something, I don't necessarily think that I would have to worry about compression lows on the thigh, but I don't know. So anyways, I just also want to put a little disclaimer in there. Make sure you have a conversation with your endocrinologist or whoever it is that prescribes you your Dexcom sensors, and just make sure that they are okay with you wearing your sensor wherever it works for you. That is what my doctor had told me, and Dexcom is completely okay with that. If you have to ask for a replacement, you have to make sure that you have the ability to wear them in other locations other than the back of your arm. I usually just tell Dexcom that it was on my arm just because, like, that's the only FDA approved location that you can put a Dexcom sensor. But I have made sure that every new site that I have tried, I have like checked with a finger stick to make sure that it's an accurate location. And I've heard of people like using their calf and things like that for sensor placement. I would be a little bit hesitant about that just because of compression lows and things like that. But so far, my favorite site locations have been, like I said, my thigh, the top of my thigh, and the chest. And like I said, I don't mind the forearms, but I do tend to get more questions, and people ask me what it is, people ask me how it works and things like that. So just be aware that if you wear your sensor in a visible spot where people can see it, like the forearm, especially if you work in healthcare, you're going to get a lot of questions. I mean, you're going to get questions regardless because people are curious about what it is and what it does. But especially if you work in healthcare, you're going to have questions about how it works and things like that. And I have told quite a few patients about it and about the benefits of having a CGM, especially when I'm talking to some of my diabetic patients. I have made sure to emphasize the benefits of having a CGM, especially if I think that it's something that they could benefit from personally. So anyways, those are my favorite sites. If you guys have any questions about using a CGM, why I use a CGM, why I find it helpful, anything like that, or you have any topics you would like me to discuss on my channel in the future, I would be more than happy to do so. And with that being said, that's all I have for today. So I hope you guys are having a wonderful day, and I will see you guys next time.